Today, we're taking a really necessary look at the interconnected world of autism. Our mission is to move past some of the older ideas and zero in on what's actionable, looking at this critical link between the brain, the gut, and the immune system.
Exactly. And the sources we're looking at are so clear on this. It's a systemic issue. You have this genetic foundation. We're talking over 230 flagged genes. And then you combine that with early environmental things like maternal stress or an infection. Our goal here is really just to share the knowledge because understanding the biology, that's the first step toward real compassion.
Okay, let's unpack that. So the big takeaway is that it's all linked. We have to stop thinking this is just a brain issue.
That's it. The body is actively influencing what happens neurologically. So the core mechanism starts really early. You have those genetic predispositions. They meet an early hit. And the brain's own immune cells, they're called microglia. They go into overdrive.
Microglia, so those are like the brain's little cleanup crew.
Yeah, think of them as the sanitation and pruning team. But when they get inflamed, they get aggressive. They start pruning synapses incorrectly, which stirs up this chronic inflammation that can really hinder social and sensory wiring.
And this is where that concept of the leaky back door comes in, the blood-brain barrier. The sources are saying it's compromised in, what, 50 to 70% of cases? That's not a small number.
It's not at all. And when that barrier is leaky, inflammatory cytokines and, gut byproducts, they can just sneak right into the brain. It just adds fuel to the fire.
So if things are sneaking in, what can be done? How do you, seal that barrier?
Well, what's so fascinating is the potential for non-pharmaceutical interventions. We see these models where specific nutrients like zinc and serine, they act almost like a nutrient hack. They can quickly rewire social circuits, and certain compounds that help seal that barrier have been shown to cut observable traits by as much as 30% in some of these models.
Wow. And you can connect that right back to the gut, which seems like a more immediate place to start.
Absolutely. Low microbial diversity really amps up that microglia stress. But then you see clinical trials showing that probiotics, specifically bifido strains, the kind you find in yogurt, can cut social and gut issues by 20 to 30%.
So simple strategies can make a real difference, like with diet.
A huge difference. You see things like artificial preservatives, Red 40 or MSG, they can spike gut inflammation. And one clinic reported that by removing them, they saw up to a 35% reduction in anger and meltdowns.
That's incredible. That direct line from the gut to emotional regulation.
And you compare that with physical sensory techniques.
Like what?
Well, the sources talk about predictable sensory input. Think of like layered ocean waves or whale songs. That kind of pattern can actually quiet the microglia noise and literally drop someone's heart rate by 15 beats. It just melts the anxiety.
And what about more active things?
Physical engagement is key. Proprioception training, that's just a fancy word for balance and body awareness. There's this blindfolded marching challenge where a therapist's voice guides a toddler's balance. After just a few sessions, they were cutting their veering motions by 40%. It recalibrates the brain.
Okay, so if the physical world has this huge impact, what about psychological stress? I mean, things like bullying must cause these intense cortisol spikes that just fry the system.
It does. It can fry the HPA axis, which is our whole stress response system. This is where building resilience comes in. The sources suggest this three-step scripting armor technique. First, parents learn to spot the microbullying, the eye rolls, the whispers. Second, you teach a rehearsed two-line comeback. Something simple like, "That's not cool, stop," and then you walk away. And third, you role play it every night so the brain learns it as a skill, and you get that dopamine reward from feeling prepared.
I love that. And there are physiological tools too, right?
Right.
For right in the moment.
Yes. The 90-second cold face trick. You just splash your cheeks or dunk your hands in ice water. It shocks the vagus nerve, the body's main calming highway, and it rapidly crashes cortisol and releases soothing oxytocin.
And then you follow that up with, what was it, wind logging?
Wind logging, just cementing those tiny successes to give the brain that critical hit of dopamine. The vagus nerve is just saying, enough, I need a reset. That solitude has to be respected. It's therapy. It's how the system regulates. The sources point to how focused contemplative practices like gratitude journaling or even just intentional reading can activate that same calming vagus nerve response. An activity that really focuses the mind, like prayer, you can flip that switch, letting cortisol tank and allowing serotonin and dopamine to rise. It provides real stability.
Let's end with this thought. One of the sources noted that over 80% of autistic teens want more genetic research for understanding, not for a cure. Maybe the deepest form of compassion really does start with seeking to understand. We encourage you to explore tools that bring focus and peace. Leveraging deep breathing, gratitude, or even focused reading of texts like the Bible can be powerful ways to regulate the nervous system and find that stability.